Hey guys, welcome back to UWorld's Next Gen NCLEX review. My name is Nkoli and here with another question drill set. If you're new here and don't know how a question drill set works, well, welcome in. Glad to have you. Glad you're tuning in to get some free NCLEX studying. But how it works is I will pull up a question here to my side, give you about 30 seconds to review it, think about it, drop what you think the answer would be in the chat, and then we will go over why the right answers are right and then the wrong answers are wrong, just to get a better practice of how these NCLEX style questions work and get you in a better groove of how to answer. But how it works is I will these NCLEX style questions. Today's topic is perioperative. So think of all the things before, during, and after a perioperative operation or operation in general. So there might be some key words, hint, in the question that kind of keys you towards a certain answer of either before or during or after. And there's also some client teaching about before perioperative stuff. We have Nurse Melanie in the chat room with us today. So if you have any questions or need some reiteration, she is there to help answer all the questions that you may have. And I just like to ask fun questions to get the chat room going. I have it pulled up here next to me so I can see everyone's answers and what they're saying. So hello from Kenya and watching from New York. So without further ado, let's get started. First question, the nurse is caring for a client who's receiving moderate sedation during an endoscopy. It would be a priority for the nurse to monitor for what? Option 1, bradypnea. Option 2, presence of a gag reflex. Option 3, decreased capillary refill. And option 4, hypoactive bowel sounds. Let me know what you guys think in the chat. Hello, everybody. Welcome in. Drop your answers in the chat. Let's see some answers of what you guys think. Be sure to also share, like, follow, subscribe, all the good things on your favorite social media platforms. We go live on TikTok, Instagram, YouTube, Facebook, if you're still into that type of stuff. But you can also share it too on whatever social media platform is best for you. If you want to go back and review and watch some of our lives, you can do it on any social media platform. I just find it easier to do it on YouTube because you can actually search the specific topic that you want. But any social media platform that you guys would like. Good job, guys. I see lots of 1s and 2s. Oh, people are saying my screen is a little blurry. We'll clean it. We'll do our Mr. Miyagi again and wipe the screen. Just bear with us for a few seconds. But lots of 1s, lots of 2s. Let's go back to the question and focus on what are we looking out for? What is the priority during an endoscopy? So during an operation. That can kind of hint you towards one or the other. Sometimes you're worrying about things during it. That might not necessarily be a priority afterwards or vice versa. Good job, guys. I'm loving some of these rationales. Keep them coming. I'll move on to the correct answer, which would be option 1, bradypnea. So the main thing, like I said in the question, we're worrying about what the priority is during an endoscopy. Since they're under anesthesia and receiving that moderate sedation, we're worried about the respiratory rate. So that would be the bradypnea, which would be the ABCs, our main thing under any anesthesia or moderate sedation. So airway, breathing, and circulation. Option 2, the presence of a gag reflex. This is something that we would be concerned of afterwards, after the procedure, to make sure that it's fully intact and back and working. So that way, when they start eating and drinking, they can swallow effectively. So that would be after, not during the endoscopy. Option 3, decreased capillary refill. This is a correct option later on, or maybe not as high of a priority. Sometimes these priority questions are a little tricky because not necessarily wrong, but it's not necessarily the priority. So decreased capillary refill would be that C, but A and B comes before C, if you know the alphabet. So we would worry about bradypnea first. And then hypoactive bowel sounds, this is to be expected because hopefully they haven't eaten for a considerable amount of time before their procedure. So those hypoactive bowel sounds meaning that they're not digesting anything, which is a good thing. So good job. Airway, first, breathing first or second. Next question. The nurse is observing staff members caring for a client during a surgical procedure. Which of the following actions by a staff member would require the nurse to intervene? Option 1, the surgeon wipes sweat from the forehead and continues operating. Option 2, the anesthesia provider completes a timeout before administering general anesthesia. Option 3, the unlicensed assistive personnel counts sponges before suturing begins. And option 4, the circulating nurse provides updates to family members throughout the procedure. Drop your answers in the chat. Let me know. Someone says, is this the first question? Now we're on question 2. If you missed the first question, it's okay. You still have time to get 7 other questions. And you can always watch this a little bit later once it's posted on all of our social media platforms, Instagram, TikTok, YouTube, and Facebook. Good job. Someone said growth. I know. Good job. Lots of good answers in the chat. Thank you guys for dropping your answers and being lively in the chat today. Good stuff. Good answer. So I think we're all in a general consensus that option 1 is gross and is the option that's needing to be intervened, okay? If a surgeon wipes the sweat on their forehead and then continues operating, that is a huge no-no, that you're breaking the sterile field and you're just gross, okay? Let's just keep your cooties to yourself. So that would be an immediate action for them to completely degown and go back, re-scrub themselves, put on the proper sterile gown and equipment all over again and start all over. But the surgeon should basically know better. Option 2, 3, and 4 are all correct options and correct actions for them to be doing during a surgical procedure. The anesthesia provider definitely will be performing a timeout, not just with the anesthesia team, but with the nurses, the surgeon, and everybody in the room to make sure everyone is on the same game plan and make sure they're all knowing what everyone's roles are. Option 3, the unlicensed assisted personnel count sponges before suturing begins. Again, another very important thing to be doing so we don't have anything left in the client that could precipitate a lawsuit, okay? Option 4, the circulating nurse provides updates to family members throughout the procedure. Again, something that we would do out of the kindness of our heart, but also just to keep everyone involved about what is going on with their loved one during the procedure. So that's a correct action to do. But you guys got that one easy peasy. Good job. Question 3, the nurse is caring for a client in the post-anesthesia care unit. So now we're outside of this operation. The nurse notes the client has an elevated end-tidal CO2 level and muscle rigidity. Which of the following actions should the nurse take? Select all that apply. Option 1, monitor the client's heart rate and blood pressure. Option 2, monitor the client's serum potassium level. Option 3, initiate an infusion of warmed IV fluids. Option 4, administer oxygen via nasal cannula. And option 5, administer dantrolene to the client. Let us know what you guys think in the chat. Good job. Also, let me know, do we have any recent NCLEX passers or test takers that's scheduled to take their NCLEX? I would love to give you a shout out, wish you the best of luck, or wish you a congratulations. Get those endorphins going. Have your name on the live screen TV. Give you your 3 seconds of fame. We have Matt Drury on TikTok passed last month. Congratulations, Matt. Welcome to the RN world. TikTok challenge on TikToks is going tomorrow. Good luck, good luck. Way to get in one good last study session in before you take yours. Rebecca on TikTok takes hers next week. Don't be sick about it. You got this. You got this. Callie on TikTok takes hers tomorrow. NCLEX next week. Maria too on TikTok. Hooray DJ Mall on Instagram takes theirs tomorrow. Good luck to you. We have Vivian. Oh, I went too fast. On TikTok, takes hers next week. Good luck. A lot of people in these next couple weeks and in July. Lovely T on TikTok takes theirs the July 11th. Good luck to you. if you are testing in these next couple of weeks, next couple of months, good luck. You got this. Be at ease, be confident with what you do know. You know a lot of information, and be confident in it. Don't change your answers. You got this. Stick with your gut, okay? Okay, the correct answer for this one would be options 1, 2, and 5. So let's go back to the question and try to break it down and figure out what it's keen, what the diagnosis might be. So we have a client that is in the PACU, meaning that they just got done out of a procedure and they just received some type of anesthesia. They have an elevated end-tidal CO2 level and they're having muscle rigidity. All these three things are keen for a diagnosis that would be called malignant hyperthermia, which is a rare life-threatening condition that is triggered by either stress, medications, in this case it probably was the anesthesia, trauma, heat, and all of this causes an increased metabolic or hypermetabolic state. So not just a regular like fight or flight mode, this is like excessive. So their heart rate and their blood pressure are going to skyrocket. They're going to have very tense and rigid muscles. They are going to have hypercapnia, hypo or tachypnea. I'm trying to see what else they would have. Oh yes, and the hypercapnia. Hyperthermia is a late sign, but when they get to that hyperthermia, that's when it's becoming deadly. So we need to give them or cool them off to have everything, revert back to normal. So we need to monitor the heart rate and blood pressure to make sure it doesn't get excessively bad and go into a crisis. Monitor serum potassium because their potassium level also skyrockets, and that also makes their muscles very rigid. And that dantrolene is that medicine that will help relax their muscles. So if you didn't know what malignant hyperthermia was from it, you might have not gotten all the correct answers, but at least you've gotten some. To monitor heart rate and blood pressure is pretty generic to be doing, especially in the PACU. Monitoring the serum levels, especially potassium after an operation, and then dantrolene is the medication that is used to kind of reverse that. Option 3 and 4 would be incorrect because option 3, infusion of warmed IV fluids, we actually want to do the opposite. Since they're in that hypermetabolic state, they're going to be very, very hot. You actually want to give them cool fluids to kind of cool them down. And option 4, administer oxygen via nasal cannula. While yes, we want to give them oxygen, that nasal cannula isn't going to suffice. That can only go up to 6 liters and it's very tiny. We want to put them on a bag mask or a non-rebreather to give them the high concentration and a whole bunch of oxygen all at one time. So those are why those ones are incorrect. But you guys did pretty good. Next question. Oh, it's a long one. The nurse is preparing to teach a client who is scheduled for abdominal surgery next week. Which of the following information should the nurse include? Select all that apply. Option 1, avoid coughing to minimize the stress placed upon the suture lines after surgery. Option 2, you will be instructed to arrive at the hospital a short time before the scheduled surgery start time. Option 3, you may need to have some diagnostic procedures completed prior to the day of surgery. Option 4, it is important that you follow the instructions of when to stop eating and drinking prior to surgery. And option 5, you will be able to drive yourself home on the day of surgery after spending a short time in the recovery room. Let me know what you guys think in the chat, and we'll go from there. Miss Christian, or Mr. Christian, Christian on Instagram just passed their NCLEX with UWorld. Congratulations, welcome to the RN life. Thank you for using UWorld, and that just goes to show everyone else that UWorld can help you pass your NCLEX. Very, very nice. Good job to you. Lots of good answer choices in the chat. Love to see it. This is another reminder to visit us at uworldnursing.com, where we have a lot of resources on there. We also have our event calendar that has the next couple of weeks topics that we're covering, either lectures, concept maps, our question drills, and the different times that we go over each of them. So now that we've added extra times, I will announce them again. It's like a pop quiz for me every single time. On Tuesdays, we go live at noon with a lecture. On Wednesdays, we have our question drills or concept maps at 11 a.m. and 7 p.m. On Thursdays, we have question drills at 11 a.m. and 3 p.m. And then Friday, we have question drills at 7 p.m. And on Sundays, we have a question drill as well at 7 p.m. So lots and lots of times for you guys to tune in and get all the free resources of these question drills, lectures, all the information that you need, and extra help to get you ready for your NCLEX. Good stuff. Lots of good answers. I see 1 3s 4s, 2 3s 4s. Basically 3s and 4s for sure, and then a variation of other things. So someone asked if do we have those times and days posted anywhere? We do. It is at uworldnursing.com. That's the first main thing that you will see is our event calendar. Okay, correct answers for this is 2 and 3 and option 4. So we are looking for correct teaching points or correct patient education that we would give someone who is scheduled for that abdominal surgery. So this is a pretty big surgery for them. So they will be instructed to arrive at the hospital before the scheduled surgery time. This is always best practice. You always want to be on time, if not early, so we don't create a rolling effect of lateness with all the procedures that might come afterwards. So be on time, if not early to the surgery. Option 3, you may need to have some diagnostic procedures completed prior to the day of surgery. This is just so we can get a very well-rounded picture as well as baseline for labs, vital signs, doing your medication history. So it's easier and quicker on the actual day of your surgery. Option 4, it's important for you to follow the instructions of when to stop eating and drinking prior to surgery. This is very, very, very important because if people eat before their surgery or too close to the time, it can cancel their surgery for them. So the best rule of thumb is have them stop eating 8 hours prior to any procedure that they have. 8 hours is the recommended time. If they're having surgery the next day, we usually just tell them to stop eating at midnight. Options 1 and 5 are incorrect because options 1, avoid coughing to minimize the stress placed upon the suture line. This is actually not what we recommend. We actually want them to cough because that helps them re-expand their lungs. It might be painful for them, so then we ask them to splint with a pillow or a teddy bear on that suture line, but we do encourage coughing for that lung re-expansion. And then option 5, you will be able to drive yourself home on the day of the surgery. Like I said, this seems like a pretty big operation. They will probably be under general anesthesia, and with any anesthesia, you don't want to be driving or operating heavy machinery after a procedure. So they won't be able to drive themselves home. I don't even think you can drive yourself home after taking your wisdom teeth out. So probably not after an abdominal surgery. But you guys did very good on this one. Question 5. The nurse is completing a pre-procedure checklist for a client scheduled for surgical repair of the right anterior cruciate ligament. Which of the following findings would require follow-up? Option 1, the client has an allergy and fall risk band on the right wrist. Option 2, the surgical consent has not been signed by the healthcare provider. Option 3, the pre-procedure assessment reveals the client has decreased bowel sounds. And option 4, the healthcare provider marked the client's right knee with a permanent marker. Which one would require follow-up? Good stuff. Someone was saying, why would I need diagnostic surgery? It wasn't saying diagnostic surgery, it was saying diagnostic like labs and like scanning and imaging, not necessarily surgery. It's just like all the pre-stuff that we can do before your surgery. Lots of good answers. Someone asked, why do you want them to cough again? We want that lung re-expansion, especially after sedation and anesthesia. Your lungs get a little bit sleepy as well, so you want to re-expand those lungs so they don't get pneumonia or atelectasis. It's also why we use incentive spirometer to help re-expand those lungs. Good job, guys. This one, even though I keep talking about the other question, y'all are doing very good on this answer. See lots of 2s, which is the correct answer. Require follow-up. So we're looking for an intervention that needs to be intervened. We need to make sure it's done or not done so that no harm will happen. So option 2, the surgical consent has not been signed by the healthcare provider. This is something that we need to stop the line. If the consent is not signed before a client goes to surgery, this would be considered battery, and we don't want to go to law, or we don't want to go to court. So we make sure it's signed before, make sure everyone is on the same page with the doctor, the client, as well as the witness. So get that signed. Options 1, 3, and 4 would be correct interventions. The client has an allergy and fall risk on the right wrist. That is very a good intervention, especially since they're having a right knee repair, to have everything all in the same line so it's easier to catch and find. Option 3, the pre-procedure assessment reveals that the client has decreased bowel sounds. Like I said before, they have stopped, or they should have stopped eating 8 hours prior. So those decreased bowel sounds is showing that they have not eaten anything and there's nothing to digest. So that is a good expected finding. And option 4, the healthcare provider marked the client's right knee with a permanent marker. This is, again, keen, making sure everyone is on the same playing field, that this is the knee that is going to be operated on. So that is a correct intervention. Good job. Question 6, the nurse is teaching a client who is scheduled for a bowel resection. Which of the following information should the nurse include? Select all that apply. Option 1, incentive spirometry should be performed when awake following the procedure. Option 2, you may require electrolyte replacement following the procedure. Option 3, discontinue eating solid foods at least 4 hours prior to the procedure. Option 4, a nasogastric tube may be required in the post-operative period. And option 5, strict bed rest will be implemented for 48 hours following the procedure. Lots of things in each answer to kind of figure out. Drop what you think in the chat. Let me know what you guys think. Let me know. Let me know. Good rationales. I love it when you put rationales of why you think certain things are right. It's getting lots of 1s, 2s, 4s. Good job, guys. While you're dropping in your answers, I'm way past my normal time that I ask this question, but my favorite question to ask, where are you guys tuning in from? I love to see how far UWorld reaches in the world, whether you're here in Texas, you're here in the United States, or in another country, an international. I would love to give some country shout outs. So let's get the chat going already. Miami, Florida, Michigan, Oklahoma, Ohio, Ghana, Miami, Boston, Wisconsin, Virginia, Pennsylvania, live from Ghana, Rhode Island, Orlando, Grenada, Canada, Zimbabwe, Turkey, I think that's Turkey, Dade County, Miami, London, Ghana, El Paso, Texas, Massachusetts, Liberia, Cameroon, Jamaica, Haiti, New York, Ghana, we're getting some international people now, Nepal, Ghana, Kenya, Tennessee, Nigeria, North Carolina, Brooklyn, Chicago, Minneapolis, UK, lots of people all over. I always wondered, the people that are like in Saudi Arabia, isn't it nighttime? Are you not sleeping? You're doom scrolling right now and you're watching. I appreciate you guys. Love that. Australia, what time is it over there? Thanks for tuning in. I'm not hating on it. I love it. I love it. That's why I ask it every single time. I love to see how far UWorld reaches in the world. See what I did there? Maryland, Ghana, 6:24 a.m. You're an early bird, Anita. Good morning to you. Cameroon, Florida. Nice, nice, nice. And some good answer choices with options 1, 2, and 4, which is the correct answer. Options 1, 2, and 4, all these information should be included when you're teaching a client that is scheduled for a bowel resection. So that bowel resection is maybe taking a part of their bowel or their intestines out. So with that, option 1, incentive spirometry should be performed when awake following the procedure. Like I said earlier with the coughing, this kind of helps re-expand those lungs that were kind of put to sleep a little bit while they were under anesthesia. So we want to encourage lung expansion and get any fluid or pop up those alveoli so you can have better gas exchange. Option 2, you may require electrolyte replacement following the procedure. Again, a correct statement to say because some of that resected colon or intestines is being taken out, and that is where a lot of absorption of minerals, vitamins, electrolytes happen. So if we take some of it out, we got to replenish it somehow. So they may require electrolyte replacement. And then option 4, a nasogastric tube may be required in the post-op period. Again, another thing that they may have, it's not required, but it may be used to kind of help rest the bowels that have just been operated on and to help with gas exchange instead of it, if it's not going down, it can get up another way. Option 3, discontinue eating solids at least 4 hours prior to the procedure. This is incorrect because we actually want them to stop eating, like I said before, 8 hours is usually the minimum for before procedure. Especially for someone who's having a bowel resection, they actually might have it even longer to rest those bowels, to decompress those bowels for any stool or anything that might have been in there. So 4 hours is definitely not long enough. And then option 5, strict bed rest will be implemented for 48 hours. This is incorrect. We actually want to get them up and moving pretty quickly after their procedure. We want to get them up and going to the bathroom if they can tolerate it, if their pain is manageable or tolerable. But we want to help get that movement going because this helps with reawakening the bowels and getting things moving down there, for the lack of better words. So we actually implement it way sooner than 48 hours. But you guys did pretty good. Question 7, the nurse is teaching a client about preoperative instructions for a planned outpatient surgical procedure at 0800 the following day. Which of the following statements by the client would require follow-up? So again, this is client teaching for before a procedure. So option 1, I will eat a light breakfast the morning of my procedure. Option 2, I may require antiemetic medications in the post-operative period. Option 3, I will arrange for my spouse to transport me home following my procedure. And option 4, I understand that I may require a blood transfusion during the procedure. Let me know what you guys think in the chat. If you have listened to me at all in the previous questions of this question drill, this one should become quite easy for you. Good job. Good job, guys. It's unanimous. I'm glad you're understanding what I'm pounding in your head. This is pre-surgical teaching. Which one would require follow-up? So meaning this is something we don't want them to be doing. Good job, guys. Good, good, good. This one seems unanimous. Yes, option 1, I will eat a light breakfast the morning of my procedure. Like I said, we don't want them to eat before their procedure because it has the chance to have them have their procedure canceled. So 8 hours is usually the cutoff time before their procedure. So eating a light breakfast before the procedure, definitely not. Options 2, 3, and 4 are all correct teaching points. They may require antiemetic medications in the post-op period. Sometimes anesthesia, it causes a lot of nausea, and sometimes they need antiemetic medications to help them not throw up. So that would be okay. I will arrange for my spouse to transport me home following the procedure. Again, like I said earlier, if they're under any type of anesthesia or moderate sedation, they need to have someone who is with an intact mind to drive them home and operate that heavy machinery, okay? Get me off the road, please. Option 4, I understand that I may require a blood transfusion during the procedure. Again, it says may, it's not a definite. This is something that they sign with the consent, or they acknowledge during their consent signing time. They may require it, especially with a outpatient surgery, just to cover all their bases. It's not saying that they will, but they could be offered a blood transfusion. So it's okay. Good job, everyone. Last question of the day. Let me know how many questions out of 8 you guys got right today. You got right, because I know y'all did a great job today. The nurse in the intensive care unit is caring for a client who's receiving mechanical ventilation and a continuous infusion of propofol. The nurse should recognize that the medication is administered to what? Option 1, reduce pain. Option 2, induce sedation. Option 3, decrease nausea. And option 4, increase blood pressure. So this is a basic knowledge question. What is propofol? What is propofol used for? And also, shameless plug, and I just like to say it every single time to get as many people involved, but we are partnered with the NSNA, the National Student Nurse Association, and we're having a webinar July 14th for you guys, going over some good topics that y'all might have been requesting from us. So if you want to tune in to that webinar that both Samantha and I will be doing, check out any social media page or the NSNA website or social media page, and you can get signed up there, and the link will be sent to you, and you can tune in and have more free resources. Actually, it's not free resource. There is a small little fee, but I would love to have y'all chatting in there and talking and getting some good extra practice and studying in. Someone said, bring some case study questions. Yes, yes, yes. Case study questions is definitely something that we're trying to incorporate. It's a little bit harder, so you're test running it with some concept maps. So have you been watching our concept maps lectures? What other topics do you guys want us to cover? I already know you're going to say cardiology and EKGs and pharmacology. I know it. I know it. I hear y'all. What else would you guys want us to go over? Drop it in the chat. Let me know while I go over the correct answer, which is option 2, induce sedation. Again, like I said, this is a just knowledge-based question of what propofol is. It's an IV anesthetic used during procedures and for sedation. So it induces sedation either in the ICU or in the operating room. It doesn't reduce pain. It doesn't decrease nausea. It actually can cause you to be pretty nauseous, and it doesn't increase blood pressure. It actually probably decreases your blood pressure. So actually not the right answers. People are saying psych, mental health psych, pharmacy, OB, mental health. Love this. Pharm, neurology, fundamentals, bow tie questions. Oh, we do need to start incorporating more of the NGN stuff. Maternity or pediatrics. I see your request. I will send it over to the headmaster to see what we can do about that, okay? Thank you guys so much for tuning in. I hope you learned something about the perioperative world. If you missed part of the question drill today, we go live again tomorrow at 7 p.m. with Nurse Andrew. And until then, I will see you guys next week. Bye.